Thank you, Julio. I thank very much. I like to thank very much the Pontifical Academy of Science, giving me the honor to have the opportunity to talk here of the patient perspective. And I like also the European Academy of Cancer Science, since they felt the opportunity and the need to have me as their members just to raise with them the patient voice from Europe. Uh, I am the president of European Cancer Patient Organizations, and that was created in 2004 and started by a very important English UK journalist that had colon cancer. The idea was to overcome just the interest of cancer patients in each one of our member states, but go through work and try to get the voice of patient European level. And since then, we have been becoming bigger and bigger. Now we are the largest European cancer patient umbrella organization in Europe, and we advocate for patients to be acknowledged as equal partners and co-creators of their own health. And we work for Europe of equality, where all Europeans with cancer have timely and affordable access to the best treatment. Our interest is mainly just address to find new needs and trying, knowing them, to answer with new rights to these patients. So that, as you can see, we were very much interested in going to know more and better disparities, then the patient and caregiver rights, the problems of rehabilitation that is just not a given right to patients, and then follow-up and quality of life of survivors. But then we were also, and we are quite a lot involved in research, just trying to answer to the question that the European Commission is asking to advocacy patients to be more and more involved in research, considering that oncological research is patient-centered. So what we're trying to do is, first of all, to raise the voice of patients in European Parliament. So then ECPC was just one of the stakeholders that was co-creating the European Cancer Patient Bill of Rights. And I like to tell you that we were inspired to these two principles: the right of every European citizen to optimal and timely access to appropriate specialized care, underpinned by research and innovation, and then the right of every European citizen to receive care in health system that ensure improved outcomes, patient rehabilitation, best quality of life, and affordable health care. The perspective of patient organization in Europe in front of the initiative of the Commission to have a mission on cancer, to globally just face the problems of cancer, was felt by patients a kind of magic moment for patient and patient organization in Europe. And mainly we were strongly linked to the first consideration that is there given. By 2030, improve the lives of more than 3 million people, living longer and better. So that is the starting point for us also to advocate for member state interest to get done in each one member state a national cancer plan that starts from the consideration of the way how European cancer patient gives the guide to be taken, because all the European cancer plan is finalized to answer to question how each member state should collaborate for each own part to improve the lives of. But then is understanding, prevention, diagnosis, and what we first of all felt to stress is that support quality of life is the third pillar of the mission on cancer. That means that it considers now that 24% of European cancer patients can be considered cured, and they have the right to go a normal life and to have the right to go back to having all their rights. So then we feel that the social aspects are very important issues in the cancer patient pathways. And then we were, and we are very strongly involved in social aspect, and we see that there are a lot of inequities also in social aspect. So then one consideration I would like here from a political point of view, what we really are looking for, and we like the Commission to let us know, how is developing a national cancer plan in each member state to understand how they are just understanding what they should do. I can tell the example of Italy. We did, but we didn't approve as a Federation of Cancer Patient Organization, the way how they approved the cancer patient. They were just indicated which are the best practice, what should be done, but they didn't follow the indication of the European Cancer Patient, namely to just establish the action to be taken, the timing, and the financing. So then they're saying we have to go to 90% just screening, but they don't say how that can be reached, taking the big difference between south part of Italy, where we have around generally 45-50% of patients having access to screening, compared to the north part. So they should say, okay, we are going 45 by 2025 to 70, 65, but adding people, putting more money. That doesn't exist. So then, according to me, Italy, but like also Greece, Spain, several other countries are not doing it. So that would be nice if the Commission can update the population and cancer patient condition, how member states are facing this, because we feel that they are even not interested to have access to the 4 billion euros. So that is a major problem that should come out of this, because we are working a lot for doing so many things on science, but I don't think the patient will have access to what is given in the mission of cancer. And then I like to say that we are very, very, very strongly interested in the several recommendations. And I like to stress that the first one, just to launch an UNCAN European Initiative to Understand Cancer. And there we as ECPC, because we have been asked to be part of the several consortiums for research, and then we are also member of the UNCAN project. That is one of the most important things, where patients are there to give their indication. But what is also very important is the 7 mission recommendation. Develop a new wide research program and policy support to improve the quality of life of patients and survivors, family members, and so on. And then create a European Cancer Patient Digital Center. These are the pillars of the cancer for us. Achieve cancer, the 9-1, achieve cancer health equity in the EU across the continuum of disease. Transform cancer culture, communication, and capacity building. These are the recommendations where we as a cancer patient are trying to put our effort and just advocating with our patient organization all over the country. So then I think I have to go very fast ahead. But what I would start, first of all, to say is, if you go to see what are the disparities that we like to expose to you. The disparities are just for pharmaceutical problems. And we feel that pharmaceutical strategy for Europe is one of the most important pillars of because we cannot say as a principle that each patient should have access to innovative medicine instead of, and not, we don't take care of changing the directive OMA. So this is what the Commission is trying to do, but we are very much afraid that the document that was supposed to be discussed by the Parliament by the beginning of 22 has been, or by the end of 22, it's been delayed to the end of 20. So that means that nothing will come out of this within this legislation. So then we are having some a lot of statements, but not followed by reality. That's what we like to stress also in this occasion. And then we have to say that as we can show here, that the problem is that there are unequal access to newly registered cancer drugs, leads potential loss of life years Europe. And then you can see the difference between Germany, UK, Austria, and then the last one, Romania, Croatia, Latvia. There are big difference that goes to a tremendous amount of different timing, arriving up to the last 3-4 countries to more than 1,000 days. So then this is unbelievable. So then how should we manage to have all these things done? We are living a dramatic situation, like thousands of metastatic cancer ladies that are air low with now a pharma that take care of them, but Enertu, that is the pharma that can take care of them, it costs 80,000 euro for each one of them. So the approach and the opportunity of these people to be cured is not allowed, because this medicine that we were waiting for years and years to be available, patients have no access to this medicine. So then the other thing is just also still talking about pharma is the potential life year loss due delayed access. And you can see some of the example, how many years have been lost for 2 examples of patients of medicine that have been calculated. And then also the other difference that goes to the time between authorization of first access. In Germany, yearly patient access 70 days on average. In Netherlands, 120. In Estonia, 1,187. So these disparities must be taken in consideration. We feel that the recent approval of the HTA regulation will give the opportunity to have a better harmonization of giving the value of pharma at European level, and that then to avoid duplication. And we know that in the HTA evaluation will maybe speed up also to give the real value, and we as a patient are having a big important role, because in the domains of the HTA, patient organizations are involved to be part of the commission, just to find out also the social aspect. We have to give value of pharma if the medicine takes care also the problem of social aspect, and that is a very important problem for value. But I like to stress also, I don't see how many minutes I have. I cannot see how many.
20 seconds.
2 minutes. Oh, two. Okay. So then the other major problem is rare cancer. Rare cancer is the adult cancer are public health challenges. So then we have this conceived by the EU Commission as a means to provide highly specialized healthcare for rare and low prevalence complex. And then it's working at European level, the ERNEST that are coordinated by Eurocan, Eurobloodnet, and FedCat. But what I like to say, and this should be taken in consideration by the Commission, that it's very important to take in consideration that these ERNEST coordination are working and the budget has been allocated. ERNEST are working together for achieving their goals, but I like to show what is the main problem. The main problem is what is still needed, and this has to be understood, is just cross-border cooperation is still needed for doing several things. But what must be done? Ensure that the revised EU cross-border healthcare directive offers a functional framework that allows cross-border collaboration, access to medicine. If a patient goes from one country to another country and he cannot have access to medicine, the prescription are not used. That's what means therapies and quality medical service and prescription exchange between countries. If we don't have this, it means that the ERNEST are working for each member state, but they don't allow to have a patient that don't have ERNEST to go in other patients. So this is the basic situation that we have to reach if we want really that the awareness will give access. So then I think that we have to take care of this cross-border healthcare directive, health recommendation without application of cross-border healthcare directive. There is no hope for rare cancer. This is very well established also by knowledge of how is the movement of patient organization. So then I like to say a few more words about what we are doing in research, and then I just give you the problems that I cannot talk about, but is the survivorship care, because we have cured the people. So then we should put more attention, but it's also this very well established by the Commission, and we are working also with the several joint actions going on to allow cured cancer people to have access to rehabilitation and to find multidisciplinary center where each cancer patient can go to be followed also after being cured. I hope during the discussion to have other opportunity to talk about these problems, but I like very much that all of you are aware what is patient perspective in this moment in Europe. Thank you.